Can you hear me?
Hello, Dr. Amir. Yeah, we can hear you. Good
Okay.
morning.
Good morning. So I want to wait a little bit for other participants, and we will start just within a minute. Okay, let's get started. Hello, everybody. I'm really glad being here with you today. Thank you for joining us today. Today's session, we are going to talk about INBDE exam. I will try to give you some useful information about the exam and the requirements that you need to take the exam, and a brief information about the whole exam. So let me just share my screen with you, and we will start our session. Okay, as we told you before, this session is about INBDE exam. INBDE stands for Integrated National Board Dental Examination. So about the INBDE, they have provided a concept about just qualified candidates. So just qualified candidate is a candidate who possesses the minimally acceptable level of knowledge, cognitive skills, and ability in the biomedical, dental, clinical dental, and behavioral sciences, including the areas of professional ethics and patient management, that is necessary for the safe entry-level general practice of dentistry. This is the focal and the main purpose of the INBDE. The INBDE is intended to differentiate between the just qualified candidates with who fall below the skill level, like just qualified candidates. About the INBDE development, as you may know, this exam just started from 2020. Before this exam, we had two separate parted exams, INBDE Part 1 and INBDE Part 2. INBDE Part 1 was about biomedical science, which consists of 400 questions, and it was divided in 4 sections: anatomic science, biochemistry and physiology, microbiology and pathology, and finally the dental anatomy. And the Part 2 was about the clinical science, all the topics that are included in the dentistry, like endodontics, periodontics, prosthodontics, etc. Since you can see here, from July 31st of 22, INBDE Part 1 was supposed to be discontinued, but due to condition which was just affected by the pandemic situation, they postponed it to December 31st of 2020, which means there is not any more INBDE Part 1. And for NBDE Part 2, as you can see here, at July 31st of this year, 2022, it will be discontinued as well. So all the applicants in dental schools in the United States, or for international dentists who are seeking to apply for the dental school in the United States, they have to go for this new examination, which is INBDE. And I'm going to provide some information about this exam to you in the next slides. About the INBDE content, they have provided a new concept, which is domain of dentistry, which means the main purpose and the main focus of this exam is just on the clinical side of the dentistry. So they have tried to integrate all the foundation knowledge in a way that it integrates with the clinical part of the dentistry. So in comparison with the NBDE Part 1 and Part 2, which was taken before, its main focus would be on clinical part of the dentistry. For the domain of dentistry, you can see here, they have provided two areas of the contents. The first one is the clinical content area, and the second one is the foundation knowledge area. For the clinical content area, you can see there are 56 areas which are covered in this exam. And for foundation knowledge, there are 10 areas. As I told you before, there are 56 clinical content areas in this exam, which are categorized in three categories that you can see here: diagnosis and treatment planning, oral health management, practice and profession. We will go through all of them in the next slides. Here in this table, you can see the first part of the clinical content of the exam, which is diagnosis and treatment planning. You can see here, there are 15 areas out of 56 areas of the clinical content, which are included in this part. You can go through ADA website and INBDE exam guide. You can read all of this information, which will be really helpful for you to know about the exam. So I don't want to just dig in this material, so you can go through their website and check it out. For the second part of the clinical content, as you can see, it's about oral health management, which is consists of almost 26 content area in clinical content. So you can see it's about prevent, recognize and manage medical emergencies, prevent, recognize and manage dental emergencies, recognize and manage acute pain, prevent, diagnosis and manage pain during treatment, etc. So my recommendation is just go through their website and read all of this information. That would be really useful for you. And the last part of the clinical content would be practice and profession, which is consists of 70 parts or areas of the clinical content, as you can see here. For the foundation knowledge area, there are 10 topics or areas which are included in this exam. You can see them here: molecular, biomedical, cellular and systems level development, structure and function, physics and chemistry to explain normal biology and pathobiology, etc. So you can go through their website. I don't want to talk about this information because you can just have them in their website. And I want to just finish my presentation as soon as possible to answer all of your questions. Here's, you can see two different graphs. On the left side, you can see the clinical content area of the exam. As I told you, there are 56 clinical content area, which are divided in three parts. Here you can see the distribution of the questions in the exam in this part. There are almost 22% of the questions about practice and profession, about 36% of the questions about diagnosis and treatment planning, and 42% of the questions about oral health management. Again, on the right side, you can see the distribution of the questions among that 10 areas that I told you before about the foundation knowledge. This table will show you that why this exam is called integrated. You can see they have tried to integrate all 10 areas in foundation knowledge with 3 main parts of the clinical contents. They have provided a percentage for each part. And at the end, you can see that 36% of the questions would be about diagnosis and treatment planning. 42% of the questions are about oral health management, and 22% are about practice and profession. Here is very important information about the exam. To simplify this concept or content, I want to tell you about the content of the questions in this exam. Just imagine that there are 3 types of questions you will face in this exam. The first 30% of the questions would be standalone questions. They are simply multiple choice questions with the 3 to 5 options to be answered. Another 30% of the questions are case-based standalone questions, which means you will have a case, you will have a patient chart, whatever, a radiograph, and you will have just one question about that specific case. The most important part of the exam, which is consists of 40% of the INBDE content, is about case-based item sets, which means you will have a case-based scenario with a patient chart, radiographs, pictures, etc. And you will have between 2 to 5 questions about that specific questions. To summarize, you will have almost 70% of the questions in this exam, which are included with the patient box, and just 30% of the questions would be just simple questions, standalone questions. Here is a chart of patients that you may see in your exam. It's patient information, chief complaint, which is provided exactly by the patient, background and patient history, and the current finding. Here you can see another example of the chart that you can see in your exam. Here's another one, and there's an important thing in this picture I want to tell you. The tooth numbering system in the United States in dental schools and all the exams is the universal tooth numbering, which is from 1 to 32. So many of us used to use the 2-digit system of the numbering the tooth, which the first digit would be the quadrant and the second digit would be the number of the tooth in each quadrant. But you should know that in the US dental exams, the tooth numbering system would be the universal one. And at first, it may be a little bit hard There are a bunch of references. They are provided at the site. You can go through them. The ADA recommendation is go through the reference books and the newest lectures, which are released by the universities. So I will talk about this stuff at the end of the presentation and about our plan, how to cover all of these references. There is an INBDE practice test in ADA website. You can go check there. I think it's about 43 questions, and based on what they have said, they do not intend to upgrade the questions or increase the amount of the questions. They have put these questions there just to give you an overview and what you will face in your real exam. So about the timetable of the exam day, here is the schedule of the day of examination. You can see INBDE is a 2-day exam. you can take your day 1 and you have to take your day 2 within 7 days after the day 1. My recommendation is just go for day 2 the day after day 1 and finish your exam as soon as possible. For the day 1, you can see at the first of the exam, you will have 15 minutes of tutorial because it's an online exam. So the tutorial will help you to make yourself familiar with the type of the questions, how the exam goes, how to choose the options, for example, how to flag a question and come back to the question after that. So it will be really helpful for you to just listen and watch to this tutorial. After the tutorial, you will go to the section 1 of the exam, which is consists of 100 standalone items in 105 minutes. Then you will have 15 minutes optional break. You can skip it, it's up to you. You can go to the second part, which is 100 standalone questions again, and then you will have 30 minutes optional break, which would be actually your lunch time. Then you will go ahead to the next part, again, 100 standalone items. Some of these standalone items may have be included with some charts or patient information, as I told you, because 70% of the questions of the exam will contain a patient box, and it would be on case-based scenarios. So the last part of the day 1 is just 60 items, and you can see here it says item sets. So from here to the end of the exam on day 2, all the cases would be item sets. So which means you will have a case base, and you will have 2 to 5 questions about that case. For the day 2, as you can see, it just consists of 140 questions, which is separated in 270 parts, and they are all case-based item sets. Overall, the whole time of the exam would be 12 hours and 30 minutes. About the INBDE fees, there is an INBDE fee in amount of 810, and there is an extra charge for international candidates in amount of 300. I want to tell you that whenever you are registering for the exam, you can choose which destination are you going to send your results at the first, and that will be free. But if you just do it after the releasing of the results, you have to pay a fee to send the report to your destination. Here you can see information about INBDE scoring. First of all, INBDE exam is a pass and fail exam, which means if you pass the exam, they will simply send you an email which shows that you have successfully passed the exam. But in their calculations, they consider the scores between 49 to 99, and you should get 75 or above 75 to pass the exam. Again, if you pass the exam, you will receive just a simple email that you have passed the exam. And that's what they will send to the universities that you are applying for. Basically, it takes 3 to 4 weeks for the results to be released. And based on my experience, it would be in 3 weeks. As I told you, INBDE results reporting for those participants who has passed the exam would be a simple pass report. But for the remediation purposes, candidates who fail are provided with information concerning their performance in the following areas: foundation knowledge area in 10 sections, and clinical content in 3 sections. And I will show you in the next slide. Here's the score of a candidate who has failed the exam. Here you can see the point that the candidate is standing. This line shows the pass point. And here is the average of the scores of all other candidates that have taken the same exam. Here you can see 10 areas of the foundation knowledge and 3 main parts of the clinical content. They are provided the information where the candidate is standing and where should go to pass the exam. So it will be really helpful for the candidates to improve their weaknesses. About the INBDE attempts, it is based on 5-year, 5 attempts rule, which means if from the date of your first experience for your first exam, you will have 5 attempts, or you will have 5 years to pass the exam. If you cannot meet this criteria, you will have just 1 chance in a year to pass your exam. And waiting period between failed exams is 60 days from the date of the failed exam. So you can try it more and more, but my recommendation is just go for this exam whenever you are ready. And I will tell you later why I'm emphasizing on this point. About the eligibility requirements, there are 2 types of applicants for the INBDE exam. First of all, accredited dental school applicants, they are the dental students in the dental schools or graduated of accredited dental schools in the United States. They can go through a very straightforward way. There are some specific forms that they can just get their dean's signature under them, and they can go through the exam. But for majority of us who are from non-accredited dental school applicants, the process is different. And there are some steps that should be taken to be eligible to get this exam. For non-accredited applicant requirements, there are 3 steps that should be taken by each candidate to be eligible and take the INBDE. The first step is DentPin registration. The second one is the ECE request. And the third one is Prometric Center scheduling. I will go through all of them briefly and will give you some information about them. First of all, the first step would be obtaining your DentPin. What is DentPin? DentPin is a dental personal identifier number for the US dental educational system and standardized testing programs. This is an 8-digit number. You can go through ada.org, ADA website, and you can find a specific section to obtain your DentPin. There are some forms that you should fill them out. It's really straightforward, and you can get your DentPin. And remember, whenever you get your DentPin, all the dental exam scores that you are obtaining in the United States will be connected to this DentPin, and it will be saved forever. So if you fail in one of your attempts in INBDE exam, all the histories of your exams will be sent to the universities that you are applying for. And it's really important. I recommend you just go for it for this exam whenever you are totally ready for this exam. The second step for getting eligibility to get INBDE is submitting your documents to ECE. ECE is Educational Credential Evaluators. It's an organization in the Milwaukee, United States. And their job is just they will convert your dental educational documents into the US format. So that would be identifiable by the US and Canadian dental schools. After you obtain your DentPin, you should go through the ECE website, and there are some forms. You should fill out all the forms and ask them to send a report to ADA about your dental educational documents. And you have to send the original or notarized one of the dental educational documents to ECE So they will convert it into the US format and they will send an electronic report to the ADA. Now we are heading to the third step of getting eligibility. After ECE report will send to the ADA, the ADA will send an email to you with a confirmation number and eligibility period of time to take your INBDE exam. That's the time that you can go through the Prometric Center's website to schedule your exam. Prometric centers are centers to develop and deliver certification and licensure exams in Canada and in the United States. There are lots of Prometric centers right here in Toronto and other cities in Canada. So you can go through their website and schedule your exam. There are a lot of spots there, and you can choose your time. You can reschedule your exam very easy. And this is one of the good points about the INBDE exam, that everything is flexible about this exam. To summarize, INBDE exam is a 2-day exam with 500 questions, which is in 2 main content, foundation and clinical content. Foundation content would be from 10 areas and clinical content from 56 areas, which is divided in 3 main categories. And this exam is based on domain of dentistry, which means that they have tried to integrate the foundation knowledge and the clinical part of the exam together. And here's a summary of the application for the non-accredited dental school applicants. First of all, obtaining your DentBin from ADA website, then submit your documents to ECE, and after that you can go and schedule your exam with Prometric centers in their websites. Now I want to talk about the course that we are going to launch in Confidentist. As you may know, last week we had this the same session about the ADAT exam, and now I want to tell you that we are finalizing our course for ADAT, and I want to tell you that this ADAT course can cover your INBDE exam as well. My recommendation is anybody who wants to seek for dental schools in the United States and is gonna go to get our ADAT course, at the end of ADAT course would be ready for the INBDE exam by small changes. So I'm thinking about just providing a very short crash course to just give you the concept of INBDE, which is different from ADAT exam, to be prepared for the INBDE exam. For the ADAT exam, we are trying to provide a flexible course, which is divided in different parts. We are dividing this course into 4 parts. The first part would be just covering the biomedical science part of the ADAT. The second part would be for covering the clinical content of the ADAT, and the third part would be for covering the data and research part of the ADAT. At the end, we will have 2 specific mock exams for the ADAT exam. So for the first part and the third part, which is biomedical science and the data and research part, I will be there for you. We will have almost 30 sessions, 3 sessions in a week. I think that would be almost 3 months. And after finishing this part, we will go through to 2 mock exams for the ADATs. But about the second part of the exam, which is about the clinical part, you can use AFK material from Confidentist. So there are different courses by Confidentist. You can go through their live courses. You can go through their recorded courses, or you can just get their booklets. It's up to you. But for the first and the third part of the course, I will be there with the live courses. As I told you, I think that would be almost 30 sessions, and it would be 3 sessions in a week. For those who are taking ADAT course with us, my recommendation is after you took your ADAT course and you took your ADAT exam, you are almost ready to get your INBDE. So just don't waste your time. I'm trying to figure out how to do it. I'm going to provide a crash course just to give you the last points that you will need to switch for INBDE exam. And I think you would be fine after 1 or 2 months of taking your ADAT exam to go for INBDE exam. And another thing that I'm thinking about that is for those of students that are seeking for INBDE exam, there would be 2 or 3 specific marks specifically for INBDE, because INBDE is a different format from ADAT exam. So it's up to you. You can choose any of these courses. We are just trying to help you there based on your needs. You can contact Confidentist in a near future, and they will post all the information. I want to give you just the overall view about what we are going to do, and just keep following Confidentist group. You will find out about more information. Another thing that I want to mention is I've asked the Confidentist group to provide a link. I think that would be from this Monday. I will be there for anybody who needs more information about the application process for the United States dental schools, because there are so many points that you should know about how to apply for the United States dental schools, like how to apply for the CAPID website, how to prepare your personal statements, how to arrange your CV in a good manner. And there are lots of information that I have, and I would be happy to share with you guys to help you get through this process. And for the last point, I want to mention that if you talk with many of the applicants in the United States dental schools, they will tell you that there is no need to take ADAT exam for advanced placement programs in the United States. And this is correct. But if you go through the CAPID website and just study the university's websites, they will say, we don't need ADAT, but if you have ADAT, we will consider it. So that's an important point, and it can make a huge difference between you and other applicants. Because as you know, there are lots of applicants and it's really competitive. So you should have something that make a huge difference between you and other applicants. So as I did, and it was really useful for me, I will recommend to you, if you are going to apply for the US dental schools, it's better to take both ADAT and INBDE. And as I told you, I'm trying to provide the enough material and information through the Confidentist group course to help you get through these hard exams. So that was the brief information about INBDE. I just tried to clarify everything to you guys. So if you have any questions, I'm ready to answer your questions. Just let me stop my sharing, and please raise your hand through the application, and I can choose you one by one, and I can answer all of your questions. Thank you.
Sorry, I don't have the raise hand option.
Who are you?
I'm Shahrzad.
Okay, you can ask your question first.
Okay, thank you in advance for all these perfect explanations. So I just have some really short questions. As I know, like ADAT is for specialization mostly, if you want to do specialization in the US, right?
States, yeah.
Yeah, I think I'm in Budapest. I'm a dental student in Budapest, and one of the students who graduated from my university said that the Michigan University does gives you like the prosthodontic specialization without doing the 2-year equivalency program when you do the ADAT examination. I wanted to know if you have any information about that. Is that true or not?
Yeah, it's true. You can go for the specialty programs in the United States, and for prosthodontics, you don't need to take ADAT. But again, I will recommend to take ADAT. And it's a different way. There is a different website, ADEA Pass. You have to go through the ADEA Pass. All the universities, almost all the universities of the United States programs are linked to ADEA Pass, and you can go and just insert all the information that they need and apply for the universities. Yeah, you can go, but after you finished your education there, you cannot work in all the states in the United States. That's the point. But if you go through the advanced placement, so you can go work anywhere in the United States.
Okay, so you mean if I want, so I don't want to just work in the United States, I want to do specialization. So if I want to do specialization,
you can go ahead. You can go ahead.
So I don't need to do the 2 years equivalency program. I can just directly apply for a specialization, but I have to choose the state that I want to live in.
Totally, it's a different way. It's a different website. CAPIT is a centralized website for students who are just seeking for advanced standing programs in the United States. There is another website, which is ADEA Pass, which is designed again like a centralized website to go for specialty programs in the United States.
I see. Okay, thank you so much. And my second question is, you said that INBDE sends your results to the universities. So my question is that, aren't we supposed to give the exam first and after we pass to then apply to the universities? Or like these go hand in hand? How is the process?
You will have some time. If you go through the CAPIT website, you can say there is an option. There is a part that you can tell them that what exams you have taken or you are going to take. You can just, for example, send the option that I'm going to take this exam and I will send, and you will have a time to send it.
Okay. And do we have to mail our diplomas, like original diplomas, like in Canada? I know that we have to mail our diplomas.
You need to send your transcript, yeah.
Okay. And one last question, as I think that you're Persian too, based on your name. So we citizens of Iran, we have the problems of visa. So my question is that, do we come to US with a student visa when we want to study in those universities, when we get accepted?
Yeah,
I mean, first I think, so it's like a student visa based, right?
Yeah.
Okay.
For sure, you have to get it because you want to just use the insurance and other stuff, so you have to take your visa.
Okay, and if I remember correctly, you said that this Confidentist course is mostly on ADAT, so it's not on INBDE. It's ADAT based. For now, ADAT and INBDE material is almost the same, but the main focus would be a little bit different. So it's a little bit tricky. If you are preparing for ADAT exam, I recommend you go for it. If you want to go for a specialty program, for sure go for ADAT. And after that, you will be ready for INBDE for sure. Just by a final touch, you need just get some guidance to how approach the questions for INBDE, and you will be fine. Thank you. And do I have to have my diploma before, before applying to this ADA Pass website? Do I mean, like for Canada, I know that I have to have my diploma to register in the website. But do I still need my diploma, or can I apply now and then get my diploma?
You have to send it for ECE. You have to send it for ECE, and they will send the report to ADA. So yeah. That's a part.
Okay, perfect. Thank you so much.
No worries. So, anybody has question?
Hello, Dr. Amir. Hello, Dr. Amir. First of all, thanks so much for the beautiful explanation. So I have a question. After the exam, how long does it take to make the profile on CAPIT and make the CV and SOP? so that I can plan my exam accordingly and get the results. I don't know how long does
If
it
your
take.
question is about that, you can reach this cycle. It depends on you. If you are fast enough, you can reach. Yeah.
So does it take a month or
Yeah,
like a
CAPIT
week?
is a holistic applying. So there are lots of stuff that should be taken in the website, and
Okay.
you know, today it's not a good time to talk about that. I can provide you many information, but today we are just talking about the INBDE exam. Yeah, I think it takes 1 month almost. Yeah.
Okay. And before planning to write the exam, I want to ask you a question. Do I need co-signer? I'm Canadian citizen, but to study in US, would I need co-signer, or can Canadian bank can give me loan?
You're a Canadian citizen right now.
Yeah. Yeah.
Uh, if you want to go to the United States, even
Mhm.
in Canada, you will need a co-signer. Yeah. Because for
Okay.
Canada, you are going to the US, so you need a consigner here. And if you go to the United States, so you're from
Mhm.
Canada, again, you will need a cosigner.
Okay. Perfect.
Yeah,
Thank you so much.
no worries.
Excuse me.
Yeah.
Thank you for your useful information. I have a question. I got my EC evaluation
Uh-huh.
3 days ago,
Uh-huh.
but I want to take the INBDE exam
Uh-huh.
8 months later.
Okay.
When should I register for the exam? How much time before the exam? I want to ask this. 1 month before?
Yeah, it's too early for you to go to register, because whenever the ADA sends you back an email, they will provide you an eligibility period. So if you want to extend it, you have to pay for that. So it's not a wise decision to do right now. I think 2 or 3 months before your intending time would be a fine date.
So at that time, I should, for example, email ECE to send another email for ADA?
I don't think so. They do it.
Or it will kept there?
Yeah, no, it would be there. It would be there. I don't think so. ADA would have your EC. Whenever they send it, they will have it. You have just go through the ADA and ask them for eligibility period for taking your exam. That's it.
Okay, and you told that you would talk about references at the end of your Zoom meeting.
Yeah.
And for example, some things like mental dental slides and some pamphlets like A Master, you know, you think how much they're useful, or dental decks or something like that?
I can tell you they are all useful, but you know, in INBDE, because before that it was part 1 and part 2, so it wasn't that much extensive like INBDE is right now. So in exams like INBDE, it's really important to study wise. If you're gonna go through all these stuff, I want to tell you that dental decks is a very useful material that you can use, but it has 2 problems. First of all, it's very holistic and it's too much for INBDE. The second one, it's just, you know, scattered information. It's not just focused. So it's a little bit tricky. So you have to spend much time on dental decks, you know. If you want to go through something which is more organized, and it's just shorter than that, because it's really holistic. I know I've been through the dental decks. It's really useful, but if you can do
a lot of
yeah,
information.
Yeah, that's perfect.
What about mental dental slides?
Mental dental slides? I've not
Slides and
heard about
videos on
that.
YouTube.
I have not heard about that. There are lots of companies and institutes that are providing different materials. So that's what I'm doing specifically for the ADAT. I'm trying to get information from the top students in the United States dental schools, and I'm getting their recommendations. And another point that I'm trying to do is just use my experience, because I've been through all the questions, all the release questions by ASDA. from the oldest one to the newest one. So I've reviewed them several times. So I'm totally aware about the questions. And I'm just trying to put my main focus on the most necessary points of materials in this exam.
Yeah, thank you so much.
No worries. Any other questions?
May I, if anyone
Yeah,
is
sure.
not asking? Sorry. So in order to sit for the ADAT exam and then do specialization after, am I supposed to make a profile in ADA Past or in ada.org?
ADA Pass. ADA
Okay.
Pass. Yeah, you
Okay,
should go through
thank
the ADA Pass.
And what is this CAPIT? So the CAPIT is the one that gives you the universities that are eligible for you to apply?
CAPIT is a separate website, which is just provided for the students who are seeking for advanced placement, just for the general dentistry. ADA Pass, which is linked with the Dental Match, which is a different organization in the United States. It's just provided for the specialty programs.
Okay.
Specialty
Okay.
programs and AGED programs. You know, we have another specialty which is called AGED in the United States, and it's just 1 year, and you can go through it, and you will have permission to work as a dentist in some states of the United States through the AGED. But again, AGED is different from advanced standing programs. Advanced standing programs are just focused in CAPIT website, and AGED, along with other specialties and GPR, they are all located in ADA Pass.
Okay, I got it. Thank you so much. Thank you.
No worries. So,
Excuse me.
yeah.
So with AGED, we can work as a dentist in the United States, but in special parts, or I didn't understand the difference between AGED and the advanced learning.
AGED is a course is basically taken by the United States dental school students and Canadian dental school students. After their graduation, they go through this 1 year course to get more familiar with the general dentistry stuff. You know, it is just based for them, but just a few of the programs in the United States will take students from the international students, and I can tell you that it's almost zero chance. Don't go for that.
Oh, so the only chance for us to work as a dentist in the United States is to, for example, applying as PASS or CAPIT, yeah? Program.
Yeah.
Thank you.
CAPIT is for advanced standing, and ADA Pass is for specialty program.
Specialty.
Yeah. And another point for the doctor that was asking about the specialty program. If you go through the specialty program, after you finished your specialty program, if you go and get an AGED program in one of the universities in the United States, so your general dentistry will turn into the United States equivalent, so you can work in everywhere in the United States.
Yeah,
oh, so you mean like you can do like the specialization and then you can do the
You
AGED
can go through
so that you
one
can work
AGED. Yeah, you can go through
okay.
AGED, and then you will be eligible to work in anywhere in the United States.
Thank you so much for these tips.
No,
And none of us knew it. Thank you.
I know. So, is that
Dr.
all the
Ahmed?
question?
Sorry, I just have a question.
Yeah.
So could you please organize another session about the application process? How to apply, or
I
what's
told you,
needed?
I've talked with the confidentialist group, so they will provide you a link, and you can come through to the link, and I will be there for you, because, you know, if I want to talk about this stuff, it would be really personal, and it's not a general concept, so I cannot talk about them in a general meeting like this. You know, INBDE is a general concept, so I can talk about that, but other stuff about the how to apply for the dental schools, it is depend on the specific candidates that I'm talking with. So I cannot just provide general information about something like this. So just please wait for confidential. I think it would be after Monday. They will provide a link, and I will be there for you to help you out.
Okay, sure. Thank you.
No worries. Any other questions?
Yes, I have a question. How important do you think is the ethics part of the exams?
In what exam?
In the INBDE exam, the ethics subjects.
If you check the INBDE guide, you will see that it's just a part of the exam. It's not that much. So if you want to just make a comparison with other parts, it has some questions, but it depends. You know, INBDE exam, it's not a predictable exam. They have a collection of the questions, and they will provide it randomly sometimes. And what they are considering is not just the number of the questions that you are answered. If you go through their website, they will explain to you that they are consider different questions based on their difficulties, and they know some of the questions are easy to guess. So which means if you get, for example, if you fail your exam with 74, it doesn't mean that if you just have answered one another question, you will pass the exam. It's not like that.
Okay, thank you.
No worries. So any other questions? Okay.
Yes, Dr. Amir, I have one question.
Yeah.
So thank you very much for the wonderful lecture. So in the conclusion, is that correct that it's better to register for the ADAT exam instead of INDB? Then we will get some lecture if we want to give the NDB exam. Is that correct?
Yeah, well, that's I'm telling you, it's up to you. We are just providing different options for you. So it depends on your personal needs. You know, you may find yourself, you are fine with just ADAT material, and you don't need to go to the crash course. So you can just go through our INBDE mock exams and do your exam. You know, it depends on you. That's I'm trying to tell you. That is, we are trying to make a flexible program or plan for all the students, so you can just choose whatever you need.
Okay. Okay.
Yeah.
Thank you very much.
It's up to you.
Okay. Thank you.
No worries. So I think we're done for today. Thank you for all of you, and good luck, and hope we will see you in our course. Have a great day. Bye.
Thank you. Bye-bye.